Welcome to Columbia Valley Community Health. We're super fortunate to have this beautiful new clinic building. It was very fun. We've been in this building now for 3 years. I've been here for 6 years, so I got to be part of helping with the construction. And it was really fun to get to be really intentional about our design. When we first had our grand opening, a lot of people came through and said, "Oh my gosh, you wasted so much room in your waiting room." And we actually felt like this was a really intentional choice for us to have this big, beautiful waiting room. And the reason for that is we want our building to feel like a place people can come to be, whether they're getting medical care or dental or visiting WIC or seeing our psychologist, that this is just really community space. Even if they don't have an appointment, that they could come and be here. The closest place or the cheapest place to buy groceries is Walmart. The bus only runs out here every 3 hours. And so if you've gone to Walmart across the way and then you're waiting for the bus, sometimes you have nowhere to go. It might be cold, it might be hot. It's hard to wait outside. And we wanted our space to feel like somewhere you could just come and wait. So we intentionally put in all sorts of charging stations for people to charge their devices. We have all different types of furniture for people to sit and relax. And whether you're here for an appointment or just here because you need somewhere safe to sit and wait, we're totally in for that. So that's a really fun and a really meaningful part of our clinic for our community. We also put in beautiful outdoor space so people can go for walks and just come and be present in our space, whether they're here for an appointment or not. So now we're gonna go check out the back, so we'll head this way. So we've got these beautiful big waiting areas and space for people to sit. Lab is down this way. Our behavioral medicine team works back in this space. Dental and WIC are up there, so we have full spectrum primary care, wraparound care right here in our building. We'll go check out an exam room. So we went with a little different style of exam room. So on every hallway when you're here in clinic, you have 3 rooms. One middle room that's a full exam room with the traditional exam table for doing pelvic exams, abdominal exams, seeing babies. But the 2 outside rooms are designed to be more of a talking room. So when we looked at the literature, the thing that makes patients most uncomfortable in the clinic is actually the exam table, the physical presence of the exam table. So if you're able to remove that, which really, if you think about what we do in clinic, you only need the exam table about 30% of the time. So that ratio works out to have 1 full exam room and 2 talking rooms. If you can just remove the exam table, it removes that anxiety for the patient. So they're not looking at the exam table going, should I sit there? Should I sit here? Do I undress? Where am I supposed to be? That's what makes patients so uncomfortable. So these rooms are really designed for the patient to have a literal seat at the table. So they're pulled right up to the desk with you. They can see the computer screen, they know exactly what's going on, and it really promotes engagement. And if the patient doesn't feel comfortable in a chair like that or sitting at the table, there is the option for the more comfortable, big, cushy recliner. So either way, whether they sit there or there, you're eye to eye or body to body with the patient with nothing kind of impeding that interaction. So that's why we went with that model. We'll walk back here and check out the residents in the team room. So this is the work area for the clinic staff. So you've got MAs working all back here. And then we'll head right into our shared team space with our residents in it. So the resident desks are in here, 1, 2, 3, 4 residents, and then a medical student desk and a nice big space for precepting and teaching. Hi, Andrew. This is one of 2 conference rooms for meetings and teaching space. And then we have a small employee gym. So here at CVCH, we value the health and wellness of our patients, but also the health and wellness of our employees. So CVCH tries to intentionally put in spaces for exercise, both in the building and outside of the building. We also run a yoga class once a week for our patients that staff are allowed to participate in it as well, which is really amazing. And then we'll come to the back here and it's just the staff break room. And that's it.